Good evening, everyone, and welcome to 365 Live. I'm Bina, and I will be your host for tonight. So, here's a gentle reminder that all information shared at this event by the speaker and 365 CPS is for general information only. Please consult your doctor for personalized and detailed medical advice. Without further ado, I'm pleased to introduce tonight's speaker, Dr. Lynette Ngor, medical oncologist at Curie Oncology. Dr. Lynette specializes in women's cancer such as breast and gynecologic cancers, including ovary, endometrial, uterine, and cervical cancers. Tonight, she will be sharing with us more about cervical cancer, its risk factors, prevention, and advances in treatment. If you have any questions, please feel free to post them in the chat and Dr. Lynette will address them during the Q&A session. Hi, Dr. Lynette. Thank you very much for joining us tonight to share your knowledge with everyone. What are the risk factors for cervical cancer and how can we reduce the chance of getting this disease? Let me hand over the time to Dr. Lynette to answer these questions. Dr. Lynette, please.
Very much, Bina. Thank you for the kind introduction. Hi, everyone. I'm Dr. Lynette Ngor. I'm a medical oncologist subspecializing in breast and gynae cancers, and it's a great pleasure for me to be here today to share more with you about cervical cancers. So without further ado, I shall start. Okay, so this is a graphical representation of the 10 most frequent cancers in women in Singapore. As you can see, the top spot goes to breast cancer. It comprises almost 1/3 of all cancers in Singapore. All the way down to number 10 is cervical cancer, sharing the same spot as stomach cancers. So in the past, cervical cancer used to occupy the number 3 spot of the most common cancers in women. But over the years, it has slowly gone down to number 10, thanks to cervical cancer screening. But this number is still not small. Every year, 300 women will be diagnosed with cervical cancer, and their cancers can be advanced and hard to treat. If you take a look at the incidence of cervical cancers in Singapore over the years, in the 1960s, it was relatively high, but over the years up to now, the incidence has been slowly dropping, if you can see from the red bold line. If you take a look at the small dotted line, this is the incidence of precancers, in situ cancer, or otherwise known as CIN. Thanks to Singapore adopting pap smear screening as part of the National Health Screening Program in Singapore in the 1980s, the incidence of precancers have been slowly going up, and this helped to avoid the cancer development because when they detect precancer, they can treat it before it turns into cancer. And that is the time we want to treat the precancer before it turns into cervical cancers. And that is how we reduce the incidence of cervical cancers. So where exactly is the cervix? This is a cartoon of the gynae organs in women. So this is the uterus or the womb of a woman, and the cervix is all the way to the bottom of the womb. And this is where cervical cancer develops. So today I'll be talking about the risk factors for cervical cancer. What are some of the signs and symptoms of cervical cancers? How we diagnose cervical cancer? Can we prevent cervical cancers? And if cervical cancer does develop, can we treat it? So what's the cause of cervical cancer? Do you know what this is? So this is a virus. The cause of cervical cancer is a virus called human papillomavirus or HPV. And this causes 99% of all cervical cancers. There are actually many HPVs around, not just one. There are more than 200 different types of HPVs. Out of these 200, only 15 of them cause cancer. And out of these 15 HPV viruses, the most common HPV is HPV 16 and 18. These two cause 70% of all cervical cancers. The rest cause about 20% of the other types of cervical cancers. So HPV is the culprit for 99.7% of cervical cancers. And how do we get HPV? How do we catch it? It's mainly caught by sexual intercourse. So anyone with a higher risk of exposure to HPV will have a higher risk of developing cervical cancers. And this includes an early onset of sexual activity, multiple sexual partners, or a high-risk sexual partner who has multiple other sexual partners, a history of sexually transmitted infections, because most of these are caused by HPV, history of vulval or vaginal cancers. These are also caused by HPV, HIV infection, because these are mainly sexually transmitted. And HIV infection also causes a reduction in the immune system. And this weakened immune system puts us at risk of having the HPV virus being persistent in the body. But HPV is not the only cause of cervical cancer. There are also other non-HPV causes like oral contraceptives and cigarette smoking. So let's talk more about HPV. It is very common because it's sexually transmitted. Most people will have some type of HPV during their lifetime, especially if they are sexually active. It's not just in the genital areas. HPV can also be in the mouth, throat, genital areas. You don't need to have penetrative sex to catch HPV. It could just be by skin-to-skin contact, vaginal, anal, or oral sex, or even just sharing sex toys. HPV infection has no symptoms. Most people don't even know if they have the HPV. And the most important thing is that you don't need to have many sexual partners to get HPV. A lot of people say, oh, this lady has cervical cancer. She probably has many sexual partners. Not true. You can have one single sexual partner but catch HPV that way. So how does HPV cause cervical cancer? Since most people may get HPV in their lifetime, not everyone will develop cervical cancers. Cervical cancer mainly develops only if HPV is persistent. So if your immune system is very strong and you catch HPV, most people will clear the HPV automatically on their own. It's just like if you have flu or you have COVID, your immune system would get rid of it. But if your immune system is suppressed and HPV is not cleared, it remains persistent in the cervix, then slowly, after many years, this HPV will cause inflammation of the cervical cells. When these cervical cells remain inflamed for many years, these cells will slowly become abnormal. They will grow very quickly. They will turn abnormal. If these abnormal cells are still within the basement membrane of the cervix, which means they did not move past the basement membrane, we call this precancer. It does not spread out of the basement membrane. It remains in the cervix. So this is when we want to catch the abnormal cells. But once the abnormal cells invade past the basement membrane, then this becomes cancer because cancer invades to the surrounding organs and it can potentially spread. So cervical cancer actually develops very slowly. It first grows into precancer, and precancer, there are also three stages, CIN1, CIN2, CIN3, before it turns into cervical cancer, which is why cervical cancer is a good cancer to prevent because there are many stages and it takes many years for it to grow from a precancerous stage to cancer. It can take 5 to 20 years. And there's many opportunity for us to detect these precancerous growth before it turns into cancer. And this is where pap smear screening and cancer screening is helpful. There are two types of cervical cancer. It depends on where the cells of origin are. So if the cells or abnormal cells originate from at the external surface of the cervix, then these cells are usually squamous cell carcinoma. These are the most common type of cervical cancers. But if the abnormal cells are more internal, at the internal part of the cervix, then these cells are usually adenocarcinoma. The adenocarcinoma cells are generally known to be more aggressive and less responsive to treatment. So what are some of the signs and symptoms of cervical cancers? Unusual vaginal discharge, abnormal vaginal bleeding, heavier or longer menstrual cycles, or if the cancer invades to the surrounding organs, sometimes we get pain or discomfort when we pass urine, pelvic pain, pain during intercourse, or even bone pain, leg pain. So how do we diagnose cervical cancers? Well, we have all spoken about pap smears. So pap smear is basically inserting a plastic soft brush into the vagina until it reaches the cervix, and then we scrape along the surface of the cervix, and if there are abnormal cells, these are detected under the microscope, and then we can tell if there is any abnormality. So we detect abnormal cells through the pap test. But then scientists started thinking, rather than detecting the abnormal cells when they have already developed, why don't we detect the virus themselves, the cause of the cancer? So nowadays, we not only have a pap smear test, we also have a HPV test. So now we have improved technology. It's using the same technique where the soft brush is inserted and scrapes along the surface of the cervix, but we don't just look at the abnormal cells, we also send these cells for DNA testing for the virus itself. And it's been found that we can actually test not just for the most common 16 and 18 DNA, we can also test for all the other 15 HPVs as well. And HPV testing improves sensitivity of picking up abnormal cells to 95% compared to 55% of the pap smear, because if we did not identify the abnormal cells, we may miss it. But finding the DNA of the HPV itself would increase the sensitivity significantly. And not only that, to the happiness of a lot of women, pap smear screening, you don't have to do it so frequently. So if you just do pap smear screening, you will have to do it every 3 years. But if you do HPV DNA testing, you only need to do it once every 5 years. So that's much more convenient for us. And if we see abnormal cells, we want to know whether there's really cancer or not. We might have to do one of the all these, a punch biopsy or colposcopy, or even a lead or colonization. So what's colposcopy? It's basically the same as how we do a pap smear. But instead of inserting the brush, we actually put a microscope and we can actually visualize the abnormal cells. We can see how large the area of the abnormal cells are. And then we take a bit of tissue out to test to confirm whether or not it is cancer or precancer. By removing the tissue, we also take away the abnormal cells directly. So how do we prevent cervical cancer? We can do it in two ways. We can screen, detect the abnormal cells before they turn into cancer in the precancer stage, or we can do vaccination. So as we mentioned earlier, we can screen for cervical cancer with a pap smear testing or HPV DNA testing. And nowadays, this is widely available. The HPV kit is found in all hospitals and polyclinics, as well in most GPs. And they now not only test for the two most common causes, HPV 16 and 18, they can test for all 15 of them. So the recommendation in the National Cervical Cancer Screening Program is if a lady is 25 to 29 years of age and sexually active, she should start doing pap smear. But if she's 30 years and above, she can also add on HPV testing. The reason why younger women don't go for HPV testing is because most of them actually have very strong immune system, and if they have HPV, it's usually transient, so they usually clear it themselves. But if this HPV is not cleared then and remains with them at 30 years and above, then the risk of cervical cancer is high. And nowadays, this HPV testing as well as pap smear testing is heavily subsidized by our government. So we can get it done in polyclinics, in Charles GP clinics, and if women are enrolled in Healthier SG, they get it done for free. In fact, if a woman has cost constraints, she can also get pap smear testing done in Singapore Cancer Society for free. And the options are either do a pap smear test every 3 years, a HPV DNA test every 5 years, Or some women are more kiasu, they will do both every 5 years. And do we have to do it for the rest of our lives? Well, if a woman has reached the age of 69 years old and she has 3 consecutive negative pap smear tests, she can stop testing. Or if she has 2 consecutive negative HPV testing by 69 years, she also can stop testing. However, if a woman has ever had precancer or CIN, then she should continue for at least 20 years after the CIN has been cleared. So rather than picking up precancer or cancer through screening, we can also prevent HPV from even developing or catching HPV with vaccination. So nowadays, we have technology that has actually developed vaccines against the HPV. And WHO has launched cervical cancer prevention with vaccination all over the world. So nowadays, we have vaccines against all the different types of HPVs. So in the past, the first vaccine that was developed was actually Cervarix. So that prevented the 2 most common HPV, cancer-causing HPVs, which were 16 and 18. Gardasil developed a vaccine against 16 and 18, but also included 2 other non-cancer causing HPVs, which is 6 and 11, because they also wanted to prevent sexually transmitted diseases, genital warts. But nowadays, the latest is HPV, Gardasil 9, which prevents 9 HPVs. So the common 16 and 18, as well as the less common HPV, which are cancer causing, as well as the non-cancer causing 6 and 11. And these are all MediSafe claimable. So nowadays, most of us would use Gardasil 9, which prevents 9 HPVs altogether. And women ask me, so now that I have vaccinated myself and prevented HPV, do I still need to go for pap smear screening? Unfortunately, yes, we still would need to, because remember, HPV is not the only culprit for causing cervical cancers, and pap smear screening is easily done. So even after vaccination, one should still continue pap smear screening. If cervical cancer is developed, this can be treated. It depends on what the stage of cervical cancer is diagnosed. So it can be diagnosed at a very early stage or at a later stage. At the very early stage, usually the treatment is either surgery to remove the cancer wholesale, or if it's not operable, then radiotherapy can kill the cancer cells. If the cancer has spread to the surrounding areas such that radiotherapy cannot encompass all of it, or surgery cannot remove entirely, then chemoradiation can be done. So chemotherapy to prevent the spread of cancer to other parts of the body, and radiotherapy to kill the cancer cells where the cancer is. And that has been very, very successful. It has prevented cervical cancer recurrence 70 to 80% of the time. What about if cervical cancer is diagnosed at a late stage, at stage 4? Well, there are still treatment options. So in the past, the main treatment for cervical cancer was chemotherapy. And the 2 most effective chemotherapy drugs for cervical cancers are these 2 drugs called paclitaxel and cisplatin. That has kept the cancer under control for many years. But in the recent years, there has been a lot of advancement in medical technology and treatment, and this has enabled us to use more advanced treatment for cervical cancers. So they developed targeted therapies. So one of these targeted therapy drugs is called Avastin, as well as immunotherapy. So this is how Avastin works. Avastin is a targeted therapy against blood vessels. And we need blood vessels to feed the cancer cells for it to grow. So if we give a targeted therapy against the blood vessel, it would starve the tumor of blood, and that would enable the cancer to die. So they have found that when we added a targeted therapy to chemotherapy, that enhanced the response rate and prolonged survival. However, stage 4 cancers are still incurable until these 2 individuals discovered immunotherapy. So in 2018, Professor Honshu, as well as James P. Allison, won the Nobel Prize in Medicine for the discovery of immunotherapy. Immunotherapy are drugs that are infused into the body that enhance the immune system to detect cancer and kill cancer. So not only do we use chemotherapy and targeted therapies, we add on immunotherapy. And that has actually enabled cancers to be controlled for a very long time. And some stage 4 cancers can even be cured with immunotherapy. So that has really improved the outcome of cervical cancers in the years. And I've now reached the end of my talk. So to summarize, cervical cancers is top 10 most common cancers affecting Singapore women, but is also one of the few cancers that can be prevented, which includes screening and vaccination. And early detection is the key to cure. So by doing pap smear screening, HPV screening, that will certainly pick up cancers in the precancer stage or at the very early cancer stage when we can still cure it. And nowadays, even if cancer is in the stage 4 stage, they will continue to have very good outcomes because of the development of new drugs. Thank you very much. I'll be happy to take any questions.
Thank you, Dr. Lynette, for your comprehensive and informative sharing. It was very interesting to learn more about how HPV vaccination can help to prevent cervical cancer. So I hope everyone has also learned more about cervical cancer and the importance of early detection for the prevention of this disease. If anyone has any questions, please feel free to share them in the comments and we will invite Dr. Lynette to address them accordingly. So while we wait for the questions to come in, I have a question for Dr. Lynette. So when will it be too late for anyone to undergo cervical cancer vaccination? Is there like a age whereby after which you like it will be too late to do the HPV vaccination, or like after you have kids you can't vaccinate anymore?
Yeah. So the aim of cervical cancer vaccination is to prevent catching the HPV virus. So if a woman is already sexually active, if she has already had children, then most likely she will already have been exposed to HPV virus in her lifetime. Therefore, initially, when the HPV vaccine was developed, they actually put the maximum age for which a woman can receive HPV vaccination as 26 years old. However, over time, they began to realize that even if a woman has been exposed to HPV virus, she may not necessarily have the virus that causes cancer or have that particular virus that eventually may cause cancer. So they still recommend for a woman to continue HPV vaccination, although the benefit gets less and less as a woman carries on and gets older in life because her exposure to HPV increases as well. So it's best to get the vaccination at a very young age before they are sexually active. So nowadays, the recommendation is to have it when they are preteens or teens.
Mm, okay, thank you. Are there any like side effects that people should know of?
Um, well, as most people who have had flu vaccinations or COVID vaccination know, usually after vaccination, some women do catch flu-like symptoms. So they may get a little bit of low-grade fever. Sometimes they get a little bit of runny nose, body aches, muscle aches. But generally, that lasts for only a few days. There's probably no long-term adverse effect of the HPV vaccination.
Mm, thank you. So, may I know if cervical cancer is hereditary? Like, if someone in your family has had cervical cancer, then will you be at a higher risk?
No. So we know that 99% of cervical cancer is
Mm,
caused by this virus, and this virus is not heritable. It's not inheritable. So yeah,
okay.
it is mainly by sexual contact. It's not inheritable. Yeah.
Okay. Are there any lifestyle habits that people can take to prevent the chances of getting cervical cancer?
Yes. So we know that increased sexual contact increases HPV exposure. So if you want to reduce that, I guess if a person needs to has multiple sexual partners, then it would be good to use barrier methods to prevent infection. And
Mm.
yeah, and usually to prevent cancer, go for continuous, regular pap smear screening. That's the most important.
Mm. And I think you mentioned in one of your slides that smoking and also the use of oral contraceptives would also lead to cervical cancer. But is that like a very low risk?
It's less common. It's a
Mm,
less common cause of cervical cancer. That would cause maybe 1% of all cervical cancers. Having said that, cigarette smoking also is associated with a lot of other
mm,
cancers, a lot of other diseases. So it would be good to reduce or stop smoking. Um, Oral contraceptives is a little bit difficult. I mean, there are many reasons where people need that. So if a person is on oral contraceptives, as long as they go for regular cervical cancer screening, I think that's fine.
mm. Okay.
Yeah.
So what are the most common symptoms of cervical cancer? I think in your slide you had like quite a long list. So are there like the more common ones that people should look out for?
Yeah, usually it's irregular or menstrual irregularities. So a
Mm,
woman who is menopause and she has her period again, that is very abnormal. Or if a woman is not menopause, but her periods become very irregular, or if there's a little bit of spotting or bleeding in between the menses, then that attention should be paid to that as well. Sometimes they
mm,
also can get more vaginal discharge, which is very unusual. So anything that is out of the ordinary, I think it would be good to seek medical attention.
mm. Okay. And are there any common misconceptions about cervical cancer that you encounter frequently in your clinic?
Misconceptions. Well, I guess one is that um, a lot of them actually, when they are diagnosed with pre-cancer, they are extremely upset, depressed. Of course, when you find any abnormalities, it is very worrying to you. But a lot of the times, actually, your immune system can get rid of the HPV. Some majority, or I would say 70% of CIN1, the precancer one, it actually resolves on its own when the immune system um, is strong and overcomes the virus. So as long as you go for regular pap smear screening, if any abnormality is detected, it is easily treatable. Majority of cervical cancer are actually curable.
Mm, that's
Yeah.
yeah,
So
very reassuring.
it's not like it's not a death
Yeah,
sentence. But the important
not
thing is
like
that you must detect it. Yes, might go for the
mm,
detection. Yes.
So I think you mentioned that like the HPV is transmitted through sexual intercourse. So there's a interesting question from Siu King. So does it mean if one is not sexually active, then that person will not catch HPV at all, and hence that person wouldn't need to do a PEP test or HPV test?
That's a very good question. Um, Unfortunately, because HPV is not it's not 100, it doesn't cause 100% of cervical cancers. There
Mm,
is still a potential risk, but very, very rare. So actually in the screening guidelines, anyone who is not sexually active can opt for not to do screening, but they need to be very wary of or aware of their body. So if there is any abnormal symptoms like irregular menses or pelvic discomfort, then they should go for pap smear screening. Having said that, some women still continue to go for pap smear screening even if they're not sexually active, and I think that that is probably also a very good policy to adopt.
mm. Is there a age whereby there's a higher risk of women getting HPV and hence cervical cancer?
Um, it's actually more the duration of exposure to HPV. So
Mm,
if a young woman, that's why HPV DNA testing is not really recommended at age 20 to 25, because
mm,
their exposure to HPV is likely not to be very long, and majority of them would have some transient HPV anyway. So they usually get HPV when they are much older, at 30 to 35 years of age. However, if they are sexually active for a long period of time, then I think it would be a good time to do the testing. So if a woman, say, has been sexually active since she is 12 years old, then I think it's not just an age thing, but it's more the exposure, the risk of it.
Mm.
Yeah.
Thank you. And for younger women who have been diagnosed with cervical cancer, are they still able to have kids after treatment?
It depends on what type of treatment they receive.
Mm.
So the cancer is diagnosed very early, at the precancer stage or at the stage one. Sometimes they minor surgery, like just a lip excision of the area, is good enough to cure the cancer or get rid of the cancer. They can still have children. Having said that, even if the cancer is diagnosed at the later stage, they can still consider other artificial methods of
Mm.
having children, like egg freezing or IVF.
Mm. Thank you. Okay, we have a question from Xiong Hing. So, women who are already sexually active in their 30s with children, will cervical cancer vaccines benefit them?
Yes. So
Mm.
yes, there would still be a benefit of the vaccination. So like what we say, the
Mm.
benefit gets less and less as they grow older and older. So, but there it would still be a small benefit. So if they think that their risk is high or they are very concerned about cervical cancer, I don't think it's wrong to go for vaccination.
Mm. Okay, and we have another question. What do you see as the most promising area of research or development in cervical cancer prevention or treatment? So I think you mentioned like immunotherapy, right? Are there any other more advanced treatments for cervical cancer, or like in terms of prevention or detection?
Immunotherapy has been very successful in cervical cancers
Mm.
because somehow they found that cervical cancer, or rather HPV, causes the cervical cells to become very mutated and very abnormal. And immunotherapy works very well in very mutated cells. So that's why it has been so successful. Um, Nowadays, they have also discovered a type of drug called antibody drug conjugate. So this is a targeted therapy and a chemotherapy all in one single drug. And that has also been shown to be very effective in cervical cancers. So there are a lot of there are a lot of advances in for advanced cancers. But for the prevention and the early stage treatment, more or less, it's been very successful. I think the challenge is more for the government to enhance the number of women who go for screening. They found that even though cervical cancer screening has been so successful, the uptake of cervical cancer screening is still not 100%. And so that is what the government is working for towards. So it's more a national kind of a strategy rather than the treatment the treatment advances. The treatment
Mm.
advances are more focused on the later stage cancers, like stage four
Mm.
cervical cancers. Yeah.
Mm. But I guess you also mentioned that it takes quite a long time for it to develop, right? So there's quite a long window for people to
Yes.
detect at the earlier stage. So if
Yes.
like they can go for all these screenings, then it will like make the treatment way simpler, I guess.
Must continually remind women, yeah, to keep going for
Mm.
screening, encourage them to go for screening. That is the most important thing.
Mm. So, what role would you see like men play in preventing HPV transmission or supporting cervical cancer awareness?
Oh, good question. So HPV vaccination can now be administered to men. So men will also reduce them catching the HPV and spreading it to the women. On top of
Mm.
that, HPV itself can also cause problems for men. It can also cause sexually transmitted diseases and even cause penile cancers. So I think HPV vaccination is something that men should also consider in helping women fight cervical cancers.
So, like, men would also receive similar kinds of subsidies for the HPV vaccinations.
Uh, Unfortunately, not. I don't think so. But
Okay.
yeah, that's something that maybe the government will be working towards, I think.
Okay, that's very interesting. So I guess we don't really have many questions left. We covered most of them. So are there any like key messages that you want our audience to bring home after this session?
Yeah, I think number one, continue doing continue doing pap smear testing, and if you can afford it, do HPV testing. The procedure is exactly the same. It's just whether you would send for one test or two tests. So just go for the HPV testing. That is much more sensitive. Then the second thing is be very aware of your body. Any abnormalities in the pelvis with the menses, just go and seek medical attention. That's very important as well. And women who have children who are at the younger age group, especially in the teenagers, just encourage them to go for HPV vaccination. It doesn't hurt. I mean, it's 3 jabs, but it will protect them for the rest of their lives.
Thank you, Dr. Lynette, and thank you everyone for your questions. It's now time for Dr. Lynette to take her leave. So once again, thank you very much for sharing your professional insights and us answering all our questions.
Thank you.
Do like, share, and follow us on our social media pages for the latest updates on our events. Once again, thank you very much for joining us tonight. I hope to see you all in the next session. Take care, stay safe, and good night.